Hello everyone, I am Sakshi Dhanuka. Today we will discuss about the system that are used in a medical coding. First of all, we start about the system that is used in a medical coding. We talk about what is medical coding. So what is a medical coding? Medical coding is a process in which the transforming the medical record of a patient's that are converted into alphanumerical form or universal alphanumerical form to code the information regarding their reports. So that is called as a medical coding. In other hands, medical coding is also called as the process of converting diagnosis, healthcare treatment into a universal numerical form by using or by for the billing, insurance claim, all of this, that is called as a medical coding. And the specialist or a healthcare professional that are work under the medical coding department called as a medical coder. So what is a medical coder? Medical coder is a healthcare professional that is responsible or having responsibility for assigning standardized data codes to the medical diagnosis procedures and the services that are provided for the patient care. So the work of medical coding and the medical coder that are under the medical coding is the review the patient medical record and transfer into alphanumerical form by using coding system like international classification of disease, that is the ICD, and the CPT. These are the techniques that are used for the coding of any record of a patient. Now we see the guys what the medical coder do or the role of medical coder in a medical coding. So medical coder do reviewing the patient record, assigning and checking the patient detail. Then what are the processes and then find what are all the diseases of a patient has. Then they code the diseases into alphanumerical form and the diseases reviewed into and confirm the code of for the special diseases or of each diseases. For example, asthma, he code the asthma by a code that is J45.909. For example, cancer, Parkinson disease, migraine, hypertension, then diabetes mellitus, hepatitis, urinary tract infection, fungal infection. These are the diseases that are occurring in certain cases, and these diseases are coded by different codes or by using such a code that cause easy to carry the information or easy to collect the information or easy to maintain the information of a patient. And each disease have get a different code for their coding. So the in this case the human anatomy and the physiology are most important because the all the medical terminologies are related to the body are seeking in a HAP. And then second one is a body system and the diseases developed within them are called seen in the HAP. So the medical coder play a crucial role in a healthcare industry by ensuring the accuracy in documenting medical records, then procedure and the diagnosis that are used in the medical coding. Second one is it facilitate proper billing and reimbursement. So need to stay updated on the latest coding techniques or guidelines and regulation to currently assign so coding and the coder adhere to compliance standards. So this is the role of a medical coder. There are three methods or system that are used in a medical coding. First one is a ICD-10 CM system. Second one is a CPT, and third is a SCPCS. These are the three systems that are used in a medical coding. So what is ICD-10 CM? ICD-10 CM. First we divide the ICD-10 CM. So what is the ICD? ICD is the International Classification of Disease. Then 10 indicate that review, 10th review, and the CM is clinical modifications or clinical modification of a disease. So it includes the International Classification of Disease of a 10 clinical modification. So this system is used for the disease coding or coding of certain diseases. For example, hepatitis. So inflammation of a liver is a disease. called as a hepatitis, and this disease is coded by using the ICD-10 system. Second one is a current procedure terminology, that is a CPT. So how to code the surgery or procedure, so medical, surgical and the diagnostic procedures that are undergo during the surgeries or any treatment, that surgeries and the procedure, medical and the surgery diagnostic procedure are coded under the system of CPT. So current procedure technology are used for the procedure and the surgical treatments that are undergoing, that is coded by the CPT. Then third one is a healthcare common procedure coding, that is a SCPCS system. So healthcare common procedure coding system is used for the surgical procedures or coding of a surgical procedures. So these are the system that are used in a medical coding, and these are all about the medical coding system. Thank you.